Good afternoon. My pleasure to introduce Councilman Scott Tornquist. He's been to Rotary Club several other times. Today his topic is the free clinic that was started here in Mason City in November. In the way of an introduction, there are a few people you meet in life that have vision, and some of those people actually put that vision into action. When that occurs, it's really marvelous, and it should be recognized. Scott's vision was this free clinic here in Mason City. And through persistence and getting in touch with the right people here at Mercy, people at the University of Iowa, and then another clinic in Cedar Rapids, he was able to make this vision into reality. Please join me in welcoming Scott Tornquist.
Thank you. It's nice to be here today with fellow Rotarians. Dr. Fisher, I really enjoyed your classification speech, and I just want you to know that the fabric of our community is much richer because of the experiences that you bring to it. Thank you. You're appreciated. And Tyler, you did a great job. You're just fine at public speaking. I am pleased to announce that the Cerro Gordo Free Healthcare Clinic opened its doors this past November, the Saturday right before Thanksgiving, which was November 21st. We have been open every Saturday since then, except for the Saturday right after Thanksgiving, which we chose not to be open by reason of the holiday. Opening up in November was the culmination of about a 4-year effort. It'll be 4 years this March that the effort to get that clinic started. So that was quite a happy day for all of us. Before I tell you specifically about what we're doing at the clinic and the demographic that we're seeking to serve, I'd like to tell you a little bit about the demographics in the county and in North Iowa and why this clinic is so important. The statistics that I'm going to share with you date back to about the 2007-2008 time frame, because it was data that we collected at that time that then became the final impetus for us to move forward. We know that in Cerro Gordo County alone, and again these are 2007-2008 stats, there are about 3,600 people that are uninsured. That represents about 8% of our population, which trends very closely to the national percentages of people that are uninsured. Of those 3,600 people, roughly 2,800 of them, which is about 6% of our population, are using the emergency room at North Iowa Mercy Health Center as their primary point of entry into the healthcare system. These 2,800 people account for approximately 8,500 annual visits to the emergency room here in Mason City. At an average cost of $1,000, that's about $8.5 million per year for people that are uninsured that are accessing health care through the emergency room here in Mason City alone, that being their primary source of entry into the healthcare system. We also know that North Iowa Mercy serves about a 14-county region here in North Iowa, and if you extend the numbers across that 14-county region, we've got about 19,000 people in North Iowa that are uninsured, and those 19,000 people account for about 40,000 annual visits to the emergency room in the 14 counties served by Mercy. So the need is there. That doesn't even begin to touch the people that are uninsured. That's a growing demographic as the cost of health care, the cost of insurance premiums soars. And so we know the need is there, and that became the impetus for us to move forward. As I mentioned, it's been a collaborative effort. It started back in March of 2006. Mercy has been a key partner every step of the way. Cerro Gordo Public Health has been involved, as has Community Action, and early in the process, the United Way. Early in the effort, we formed a team that became a steering committee, which eventually led to the formation of a board in 2008. That board then led the effort to establish bylaws and articles of incorporation, and late in 2008 we received our 501c3 status from the state of Iowa. It took us about another 8 to 9 months to move the paperwork through the IRS out in Washington, D.C., which officially gave us our 501c3 classification. So now any and all donations that go to our clinic are tax deductible. What I'd like to do is just spend a few minutes telling you what we've seen since we've been open, and I'd really like to leave the balance of the time that we have to answer questions that you might have. I really prefer dialogue rather than monologue, and in so doing we can kind of take the balance of the conversation in the direction that you guys would like to take it. We've been open now through last Saturday, about 8 days. We're open on Saturdays because we're able to utilize the Dr. Lindstrom Clinic at 6th Street. She graciously has offered her clinic facility to our operation free of charge. And so it's available to us when she's not working. On the front end of this project, we've decided to be open Saturdays from 9 till noon. We see an average of 12 people per session, so that's approximately 4 people per hour, about 1 person every 15 minutes. Our clinic is served by volunteer doctors. Mercy has been very gracious in freeing up their doctors, their medical staff, and nurses from their non-compete clause because they see the value in the efforts of the clinic. Our goal is to try to reduce the number of people that are using the emergency room as their point of entry into the system. That's mutually beneficial to our efforts and to Mercy. One, it gives us the opportunity to cost reduce the overall impact to the system, which we all benefit from indirectly. As you know, even though Mercy is a charitable organization, not all of those costs can be passed on as a write-off. And so those that cannot are redistributed over the costs that they do charge, which impacts all of our premiums eventually. But most importantly, we're able to get people before they get to the point that they're so sick that they're finally seeking the emergency room. So it's a quality of life issue. We do not have good information right now on the cost of delivering services because the last billing that we have is through December, and the December billing was only for a couple of sessions that we were open in November. But what we are seeing is that on average it's around $100 per patient, give or take. I'm sure that number will go up as billings come in and we're able to hone in on the patients that we're seeing. Again, Mercy's been a partner, and we have been blessed in that they have, we're doing all of our lab work with Mercy. And they have graciously negotiated a contract with us at their lowest fee structure for the delivery of lab services. Similarly, we've been able to work a deal with Hy-Vee Drug Town to where when our patients come in, we're able to give them a voucher, basically, and they're able to head over to Drug Town and get their prescriptions filled off of the $4 list. Hy-Vee Drug Town's collecting those vouchers, and then they bill us once a month. As far as the need that we have, we wanted to raise enough money to make sure that we were able to stay open the first year without being too stressed financially. So our initial goal was to have about $85,000 in the bank before we opened. As of December 31st, we actually had about $98,000 in the bank. It took us about $10,000 to get through the process of getting open, getting supplies, and so on. All of our doctors and nurses are volunteers, as I've mentioned. For any of you that might be so inclined to support the effort financially, I'll share with you that a $100 donation will cover approximately 75 strep throat tests. $50 will pay for about 100 blood glucose strips, and $25 will pay for about 100 exam drape covers. Also, another way of looking at it is at this point in time, $100 will let us see a patient. We know that obviously $100 a patient seeing for an hour, it's costing us about $1,200 a week roughly to be open. That's roughly $6,000 a month, or right around $72,000 to $75,000 a year. So what we had in place as original estimates and the cash that we wanted to have on hand are kind of coming together now as we're open. I think that's probably a good stepping off point for me to open it up for questions. Like I said, I want to make sure that we take this discussion in the direction that you would like to see it go. Yes, sir.
Do people call in for appointments, or they just walk in?
Yes, both. We're able to see around 10 to 12 people per Saturday, and we have a phone number that's basically an answering machine during the course of the week that we've got people checking regularly. At this point in time, since we don't have a permanent home, we've got that phone ringing into the public health. And so that's how we basically book appointments, but we try to leave a couple of open slots as well because you can't always